Hello, my name is Caitlin Labar. This is from Micro 205, Module 5, Assignment Tuberculosis, video assignment. Record a short video that answers the following questions in 3 to 5 minutes. Tuberculosis is the causative agent of tuberculosis. What is the difference between latent and active form of TB? Is latent TB contagious and should it be treated? Would you expect it to be harder to treat a TB infection when the bacterium is in latent form? Why or why not? And an ethics question. In 2007, a patient infected with the extremely drug-resistant form of TB refused to follow a doctor's order and flew out on an airplane. As a consequence, he was legally confined. Other patients with XDR TB have subjected to legal confinement in hospital jail units. In your opinion, should non-compliant patients be subject to legally confinement until the treatment is effective? The latent form versus active form TB. With latent, the bacteria that cause infection are dormant. Because of this, the infection cannot be spread from person to person, so it is not contagious. With an active form of TB, the bacteria inside the body are actively growing and causing symptoms. You can also spread the disease to other people, especially people that have a weak immune systems, including cancer patients and elderly patients. Active TB is harder to treat than latent because the bacteria is actively creating more and more, possibly drug-resistant bacteria. It is easier to kill something lying dormant than something actively moving and spreading. In my opinion, if the science shows that the latent TB is not contagious and it is dormant and not creating new bacteria, then a person should not be legally confined, but a person with active TB should always be confined because the bacteria is able to spread through droplets easily through the air, and it's very harmful to others. Why harm others? If someone were to die from the disease and you were told to quarantine with it and you could have prevented, then that is your fault. Just do what the doctor says, and you really need to stay in the hospital and confined and hopefully find the right drug that'll help.